In this presentation, we will discuss the role of informatics in creating information pertinent to healthcare, the definition of disparity and the types that exist in the U.S., the meaningful application of information technology, and finally, demonstrate its application to an individual case study.
If physiology is defined as the logic of life and pathology is the logic of disease, health informatics can be defined as the logic of healthcare. If Florence Nightingale were alive today, she would be extremely pleased with the technology of health informatics, which uses science, nursing, statistics, and evidence-based care as a time-saving intervention with a goal to be helping patients in the best and most efficient manner available. Beginning with the process of turning paper charts into EMRs, many healthcare professionals believe that paper record systems are a way of the past and a computerized system is the future. With the change to EMRs, the industry realized that unnecessary paperwork was eliminated and data was more legible. EMR systems brought about lower costs and positive patient outcomes. What began with a simple change from paper to electronics has become a tool to combine with other informatics tools that emphasizes safety, quality care, and enhances workflow. Today's tools of informatics technology helps reduce errors and supports clinical decision-making through evidence-based criteria. While the healthcare field relies on X-ray surgical tools or medications, the field of healthcare informatics utilizes the internet, information systems, and clinical guidelines as their resources. Going past the creation of the EMR, we now have innovations in the field that make it faster and easier to get advice from physicians, obtain prescriptions and refills, access lab results, pay bills, and view health information online. Practitioners are able to connect with patients about their specific condition and treatment. Health plans may offer interactive games as a tool to promote wellness and reminders for preventative care for age groups. Trends that have emerged from technology are building an interconnected healthcare system. Virtual house calls can address non-urgent health issues, and patients can obtain advice from their physicians. Some health plans encourage you to use technology by using an interactive website to consult with doctors, nurses, and therapists at no cost to patient, and charging a fee for office visits. The results of using the website have resulted in fewer medical emergencies and less likely to need hospital care by staying interactive. The use of these virtual visits and websites saves patients time and makes them feel closer to their physician. Kaiser Permanente uses an online health manager that generates over 300,000 emails, 1 million lab results viewed, and 3.5 million prescriptions refilled each month. Another implementation by health plan is the care tool to analyze records along with clinical practice, and the results generate and oversee a problem list and a secondary list that will highlight preventive and chronic care. The tool puts notations in the online chart for a physician to review. In the example above, a patient has coronary artery disease and is not prescribed an ACE inhibitor. The physician will receive a notation in the patient's online chart regarding the prescription. The care tool can also notate flu shots, mammograms, or other preventive measures. The latest technology focuses on many areas from readmissions to genetics. Utilizing analytics to focus on preventable readmissions is up and coming and uses clinical data to give predictions to physicians the likelihood of readmissions. An example would be a caregiver receives information that the patient has been to the emergency department multiple times, and the care team can look how to best support the patient. Another trend that is embracing technology is to facilitate care transitions, which can be a dangerous time for patients. It assesses what the patient's needs are and gets better compliance on what they need to do to care for themselves after the transition. BYOD, also known as Bring Your Own Device, is another area that hospitals are tapping into, with some even offering kiosks that mobile devices can utilize. This recognizes the value of instant access to mobiles, which physicians find appealing and makes their work easier.
Despite the new movements in healthcare, there exist many disparities in its delivery and management. The Institute of Medicine defined disparities as differences in treatment between racial, ethnic, or other demographic groups that are not directly attributable to variation in clinical needs or patient preferences and persist even after adjustment for socioeconomic factors. Though the reasons may be multidimensional, pertinent contributors fall under three general headings, such as the health system, the provider, and patient factors. Factors involving the health system itself include whether or not the patient understands and can navigate the existing system. One may have a lack of access to care, or care may be delivered too late. Many times our system of healthcare distributes services inefficiently and unevenly across populations. Some Americans receive worse care than other Americans. Disparity in care may involve the relationship or lack of relationship to a provider, or poor provider-patient communication. The provider may exhibit bias or deliver care without full consideration of a patient's preferences and values. According to the U.S. Department of Health and Human Services' 2011 National Healthcare Quality and Disparities Report, it's too often that Americans do not receive the health care that they need, or they receive care that causes harm. There are a multitude of patient factors that can be present despite socioeconomic status, including mistrust, attitudes, lack of knowledge or understanding, or poor health literacy. There are traditionally marginalized populations in the United States. The average American realizes and accepts that communities of color, those who do not speak English well, and immigrants have all fallen victim to discrimination. These particular populations also have disparate access to health care and treatment. These are some of the current health disparities that exist in the United States. The National Healthcare Disparities Report of 2011 summarizes healthcare quality and access among various racial, ethnic, and income groups and other priority populations, such as residents of rural areas and people with disabilities. It examines disparities in healthcare access, utilization, costs, outcomes, satisfaction, and perceptions of care. The report is derived from Informatics data on more than 250 healthcare quality measures from more than 45 databases. This disparities report declared that care quality and access are suboptimal, especially for minority and low-income groups. Care is deemed suboptimal based on several quality measures in the data, including patient and family engagement, population health, safety, care coordination, palliative care, overuse of services, access to care, and health system infrastructure. The Disparities Report includes this figure, which represents the quality of care received by selected groups. Note that African Americans rate relatively high in the reception of worse care. The report states blacks received worse care than whites for 41% of quality measures. In regards to access to care, again, African Americans had worse access to care than whites for 32% of access measures, and the report states poor people had worse access to care than high-income people for 89% of measures.
Information technology, how it reduces healthcare disparities. Data mining, the use of information technology for research to determine the demographic makeup of the community. Examples are race, age, languages, etc. This allows healthcare providers to assess the needs of the community and determine how to meet these needs. Language barriers. Providers can tailor their staff by hiring bilingual staff or providing a translator. Racial and ethnic. Certain diseases are more prevalent in some populations and providers may concentrate on disease prevention. Gauges the needs of the population. Accommodations can be made to tailor the needs of the community. Allows for culturally congruent care. Increased trust in care providers. Increased patient satisfaction and compliance with teachings and treatment. Integration is the process by which different information systems are able to exchange data in a fashion that is seamless to the end user. Clients who are uninsured tend to use multiple healthcare providers. Integration would allow the healthcare provider to look at the patient history and provide care safely after verifying information. Language barriers. Client's demographic information is already present in the patient's record, which reduces the amount of questions needed to be asked, causing less distress in clients who do not speak English well. Telehealth. Telecommunication technologies and computers are utilized to exchange healthcare information and provide services such as diagnosis consultation and education to clients in other locations. It reduces transportation costs. It allows the elderly and physically handicapped to receive quality care at home. It provides a way for clients who live in rural areas to receive quality care. It prevents hospitalization by allowing for patient monitoring and alerting the physician of critical changes.
The role of informatics decreasing healthcare disparities. Case study of Juanita. Case number 1. 25-year-old HIV-positive Hispanic female. Juanita moved from Havana, Cuba to Miami, Florida on February 15, 2012. Juanita resides with her aunt. She wants to help out with her aunt's current economic situation and decides to get a job. Juanita gets hired at the local CVS. Juanita's primary language is Spanish. Her English is very limited. CVS requires a physical, and during the physical, the physician asked Juanita if she wanted to take an HIV test. Juanita agrees, but does not understand about the disease of HIV. Juanita takes the HIV test. Her results come back, and she is notified that she is HIV positive. The physician refers her to an infectious disease doctor. The physician tries to go over her diagnosis and treatment plan, but Juanita does not understand the physician. Juanita's primary language is Spanish, and her English is limited. The physician asks Juanita if she would like a Spanish translator. Juanita shakes her head no. Due to patient confidentiality and HIPAA laws, the physician wants to give an alternative way of communicating to Juanita her diagnosis and treatment plan. The physician shows Juanita an online website that helps her to understand her diagnosis and treatment plan. This online program translates from English into Spanish. Slides 5 and 6 is a translation of HIV basics from English to Spanish. This gives Juanita an understanding of her diagnosis in her language of Spanish. Slides 7 and 8 is another translation of what does HIV treatment involve. This is translated from English to Spanish and gives Juanita a better understanding of her treatment options. Juanita's case study is an example of a healthcare disparity. Juanita's healthcare disparity was her language barrier. Sometimes language barriers prevent the patient from obtaining health care. Patients who face such barriers are less likely than others to have a usual source of medical care. They receive preventive services at reduced rates, and they have an increased risk of non-adherence to medication. The online website allowed Juanita to comprehend her diagnosis.
In summary, we've learned that informatics is the science of turning data into information. We've also discussed disparities in healthcare and the meaningful use of information technology. Meaningful use in this context refers to increasing the access and quality of healthcare. These are disparate times. Informatics has already proven valuable in collecting the necessary data to determine and assess needs. As nurses, we must continually assess the pulses of the care we and other professionals provide.